Hello, and welcome to today's Women in STEM panel hosted by the WINS program, which is the Women in Natural Sciences here at the University of Texas at Austin. Hook 'em horns! We are so glad that you've joined us. So thank you so much for taking time out of your busy schedule to hang out with us today. My name is Dr. Kate Bieberdorf, and I'm an associate professor of instruction in the chemistry department here at UT Austin. I also moonlight as Kate the Chemist, where I perform science experiments for kids to try to make science fun and exciting, all while secretly trying to diminish the stigma around women in STEM. Today, I'm joined by four of our incredible alumni, Drs. Toyin Falola, Leticia Nogueira, Poppy Northcutt, and Camille Parmesan. Let's begin with an introduction from each panelist. I would like for each of our panelists to state their name, their current title or role, and to tell us a little bit more about themselves. So let's start with Toyin. Can you go first, please?
Hi, I'm so excited to be here, especially because I know there are a lot of undergraduates here. So my name is Toyin. I am a proud graduate of UT Austin Honors Biology, and I'm the incoming clinical director at Bowie Health. I'm also a board certified dermatologist and will be a clinical faculty at Dell Medical School here in Austin, Texas.
We are so lucky to have you here. Thank you so much. How about Leticia?
Hello, so I make sure I wasn't muted. I am Leticia Nogueira. I am the Director of Health Services Research at the American Cancer Society. I did my PhD at UT and then my Master of Public Health at Harvard. And I work with research, mainly looking at disparities in cancer care that can be addressed by policy changes.
Thank you so much for joining us. How about you, Poppy?
Hi, I'm Poppy Northcott. I graduated from the University of Texas in 1964. And at that time, it wasn't the UT at Austin, it was just the University of Texas. My degree's in mathematics. These days, I'm an attorney and I'm a referral lawyer with Jane's Due Process, working on reproductive rights for teenagers. And I'm also the president of Texas Now, the National Organization for Women, which is a feminist organization. But I'm probably here because in my wild youth, I was the first woman in mission control as a return to Earth specialist in the Apollo program.
And it is quite an honor to even be speaking with you. So thank you very much for joining us. I really appreciate it. But last, but definitely not least, Camille, tell us a little bit about yourself.
Hi, well, I'm Camille Parmesan. And I got my undergraduate degree at University of Texas, my PhD at University of Texas, and then I was a professor at University of Texas. And it was all great, but I did feel like it was time for a change. So I ended up being a professor in England for about 10 years. And now I'm in France, where I'm a researcher with the National Research Institute, having a good time here too. And what I work on is impacts of climate change on wild species. And as part of that, I'm part of the Intergovernmental Panel on Climate Change and doing some work with the International Panel on Biodiversity and Ecosystem Services. So really trying to link, my own personal research with kind of big picture problems and trying to get policymakers to listen to science.
It's not an easy task, for sure. Well, thank you, all of you, for joining us. I really appreciate it. We have a number of questions that have been pre-submitted by our WIN students, so I want to jump right into it and a chance to maybe get through all of them. Hopefully, we'll see. So let's go ahead and get started. So Toyin and Camille, this one's for you. Can any of you tell us about a moment that made you realize when you were in the right field and when science and math was right for you? Did you have like an aha moment or anything like that? And let's start with Toyin.
My aha moment was actually at UT Austin. I remember it very distinctly because I was taking an introductory evolutionary biology class as part of the honors program there. And it was a very esoteric talk about biological signaling and the evolution of fish. And I just couldn't believe that someone had spent their entire life dedicated to figuring out this one thing. And I said, wow, they know everything about something. And I just had a desire to have that level of curiosity and that level of dedication to a topic. And I knew then and there that STEM was for me. And I still think of that class often.
What a great story. Have you told the teacher that? Have you gone back and let them know?
I need to tell them, actually, because
should.
it really did change my life.
Absolutely. They would absolutely appreciate that. What about you, Camille?
Well, it's funny because actually my mother was a geologist, and so science was in my brain since I was just a little kid, and she would take me for all these hikes and show me every rock and every bird and every plant. So I always knew I wanted to be a scientist. But what's interesting to having these medical people here is I wanted to be a medical researcher. So I wanted to be doing what you guys are doing. And my aha moment is kind of funny, is I was in vertebrate physiology lab. And at that time, you had to do things with live animals that I didn't want to do. And I went home crying and saying, well, what am I going to do with my life? This is what I've always dreamed of doing. And so I started doing undergraduate research and ended up being in the mountains in California working on these butterflies. And I've been working on them ever since. I thought that was my aha moment. It's like, I can actually get paid to camp out in the mountains in these absolutely gorgeous scenery, working with these absolutely fantastic, little butterflies. Okay, I'll do it.
Sounds like an absolute dream. I mean, butterflies too, that's every little kid's dream. So that's absolutely incredible. So let's take kind of a right turn here. Leticia and Poppy, you're next. How do you make sure your voice is heard when you're in the minority surrounded by men that try to dominate the conversation? Leticia, let's start with you.
All right. I was hoping we would start with Poppy because I'm sure Poppy has a lot more experience. Clearly, I think that your field is very much dominated by men. But I can just say a couple of things. I think that it's important to form alliances with other women if there are any other women in the room. So from the beginning, when you start a new position, try to identify other women that you appreciate and admire. And whenever they say something, comment on it. Say, oh, that's a good idea. Or when a man repeats their idea as if there was almost like, oh, thank you for building on her idea. And when they repeat the exact same thing, oh, I'm glad that you brought it back up. And once you start doing that, sometimes the other women will start doing it too, but sometimes they won't. And I think that one thing that I learned is to try to at least finish your thought, because we get interrupted a lot. Like research shows that in meetings, women get interrupted a lot. So it is difficult because we are trained to be nice, right? So when somebody starts talking over us, we stop to listen, but really they were not listening to us. So it took me forever. And I used to play a game in my brain, even if I had to look at a pencil in front of me instead of the person who was interrupting, just try to finish your thought. And that's really the best I can say so far.
I love that. 2 quality pieces of advice right there. Like, thank you for repeating what so-and-so just said. I love that. I'm absolutely going to be using that. Thank you for sharing that. What about you, Poppy? Do you have any particular advice?
I do have a little bit of advice. I mean, first of all, I think that Leticia is absolutely right about trying to organize in the sense of getting with other women if you have other women or allies that are going to be present in the meeting. The other thing that I always do is I never go to a meeting without an agenda, okay? A personal agenda. Because why am I there if I don't have some reason to be there? So, I suggest that before you go, think about why are you there? And, do you have a point before? And if you do, maybe you even want to seek out whoever's organizing the meeting or running the meeting and let them know that you have a particular point that you want to raise. So, being prepared in that sense is important. I would also recommend to people that get involved in other organizations. I mean, this is not the only venue where you may have difficulty being heard. And everywhere you go, if you're presenting ideas, you build on that skill. I never really had difficulty, okay? And I think part of that is because I was always politically involved. So I was used to having to present, ideas and trying to get my ideas heard. So use those other forums as well to practice and to see how other people manage to get their ideas across.
It's incredible advice. I really appreciate what you're saying about joining other organizations too, because that can help you build your network and get those allies just from anywhere. And you'll take any ally, right? We'll take anybody these days. All right, so we're changing gears just again here. This one's for Leticia and Toyin. So Toyin, we're going to hit you first here. What advice would you give to a student who plans on pursuing a graduate degree or professional program? Particularly, what should they be doing during their undergraduate semesters?
And first I want to say I'm taking notes on everything Poppy is saying for myself, because we are always learning and growing as women in science. But, you know, I think as an undergraduate, you just have such a great opportunity to learn from so many different people that it's a time in your life that you can get a sort of multidisciplinary, almost polymathic approach to life. And so I always just encourage people that while we are focused on the sciences, this is a great time to build your ability to learn from other fields, because that education that you might get from liberal arts or other interdisciplinary fields can really educate the way that you work as an adult. For example, taking classes in racial justice may, especially if you're going into medicine or health policy, can really inform the way that you then implement policies as an adult, maybe not as an adult, but as a working professional. And so I think that one advice I would give is to also focus on taking courses and classwork that are sort of intersectional in the areas that you're most interested in.
I love that. And to our University of Texas students out there, there are several courses being offered right now to help us bring our awareness out for several of the racial issues that are happening right now. So pay attention to it. I know Elizabeth is reaching out to you and giving you those contacts. Leticia, let's jump over to you. Do you have any advice?
I think Toyin nailed it. Really is trying to find a thing that interests you, but at the same time, keeping an open mind about where is it that you want to go. Because sometimes you do your undergrad and your graduate, and you think that you have to stick with one field, and that is not always the case. And as your interests evolve, it could be that you create a new field that nobody has thought of. And especially with this rapidly moving and evolving science, which is only becoming more and more comprehensive, you really don't need to limit yourself in any way. So I would say just try to experiment many different topics and try to find where things intersect.
I'm going to go off script here for a second. How many of you are actually doing what you thought you would be doing? Any of you? Yeah, go off the path. Okay, I love that. I love that. Okay, Poppy, what inspired you to continue as a women's rights activist while semi-retired?
Women's rights activist all the way back into my 20s. You know, having the experience of being a woman in a highly technical area back in the 60s, which was the era of Mad Men. I had a very rapid learning curve in terms of what sex discrimination was about. And they didn't teach any courses in that at the university. You had to learn it on your own through hard knocks. And I became very interested and very active in women's rights all the way back into the 60s. So whatever I have done throughout the years, I have always done something that was involving women's rights.
Thank you. As someone who has definitely benefited from that, I really appreciate that you have plowed ahead, because my generation and our younger generation is going to continue to benefit. And hopefully all of the younger kids out there remember the slingshot method. Remember, when someone comes in your path, you ram them and you flip them over you. You help them get to the path easier than you had. All right, Toyin, you're in the hot seat now. Do you believe artificial intelligence can one day replace or take over the need for physicians? Or is the empathy that a human brings to the role of a physician what makes them successful?
I love these students because in this question, because you're obviously thinking about the ethical implications of technology in a way that I think is really important for anyone who's working in a field at sort of the forefront of innovation. So, you know, I'm working at the intersection of medicine and artificial intelligence. So these kinds of questions about both Are we replacing people? Are we replicating biases and structural racism and misogyny that are inherent in our systems and these computer algorithms and programs? Are the kinds of questions that scientists, as well as just participants in a technologically advanced society, should be asking? I think the answer is definitely no, because there are just so many qualities that are unique to humans, whether it's empathy, presence, communication, even just, I think we underestimate the importance of a clinician's touch in a sort of difficult situation. I think artificial intelligence is great because it can really augment the ability for medicine to become more personalized. It can augment your ability to be navigated through the system, and it can really help improve efficiencies, and with the goal that the patient at the end of it has more personalized healthcare and the clinician has more time with the patient due to the efficiencies that artificial intelligence has provided in the system. And I encourage all students listening and anyone interested in innovation to really be thinking about these sort of ethical implications of anything that you're researching or working on, because when you ask the questions up front, you can really change the course of the way that technology is developed and deployed.
Love that. That's great advice, especially when they can start doing collaborations. You can start working with your engineers, the biomedical engineers, and you can actually make medicine better. Great advice. Great advice. Camille, back to you. Do you have any advice for students interested in climate change research?
Yes, another male-dominated field, and I've just got to pause to say, Poppy, thank you from me as well, because you paved the way for me as well as paving the way for all these other women. Because and your advice and Leticia's are actually still valuable to me, because I'm still learning how to deal with this situation. So getting back to the question about climate change research, because it actually is very relevant. It's still a male-dominated field. It's gotten much better over the years. But my advice to students interested in it really is, first, train yourself very broadly. It's really important. So I had to learn, I'm basically an evolutionary biologist, ecologist, right? I had to learn atmospheric science, climate science. I had to learn how they gather data, what their problems are, what kind of issues they face, and trying to analyze these long-term trends in meteorological data. I've had to learn about glaciers and glacial behavior. It's like so cool. I was a behaviorist at one point. It's like now I'm learning that glacials have behavior. And until, ocean dynamics, and until you can't be an expert in all these, obviously, but you have to learn the jargon. You've got to learn how these different disciplines are thinking. And so at University of Texas, actually, you've got the Bridging Disciplines program. So if you really know you want to go into it, I advise going into one of these interdisciplinary degrees so that you can get credit for taking courses in biology and geology and and political science and all the different fields that you need to understand to put all this together to understand global climate change.
Great advice, and another good plug for the Bridging Disciplinaries program. Please take advantage of that. Okay, swinging back to Leticia here. Can you please talk about some of the policies that you have changed in your time at the American Cancer Society? And can you please briefly describe what your job entails on a day-to-day basis?
Yeah, so my job is mainly on research. What we do a lot is that the American Cancer Society has a different arm, that the Cancer Action Network, that does a lot of lobbying, and they are in DC. But we do mainly, they have a question, we look into the data and give them an answer. So some of the things that we've done have to do with the Affordable Care Act. So for example, dropping pre-existing conditions from as a impediment to receiving health insurance coverage, and also the impacts of the Affordable Care Act, since it's being implemented in making it easier for people to access cancer screening, cancer diagnosis, cancer treatment. So we've done a lot of that. And we actually done some work with climate change policies as well. And so we have a couple of publications with how climate change impacts cancer patients. And then one thing I can say here is that as if we are doing these broader federal policies, it's always good to look at the policies of your own institution as well. So one thing that we have advocated for and got the American Cancer Society to join the Medical Society Consortium on Climate and Health. So then there's a lot of steps that are being taken at the institution to make it more environmentally friendly and equitable. So that's another thing to think about.
And I'm going to push you to answer the extra part of this question here. And so, like, what does your job entail on a day-to-day basis? So, like, what's a Tuesday look like for you?
Tuesdays are good because I don't have that many meetings. It's a lot of data analysis. So we have a lot of brainstorming and coming up with project ideas. And then we have these huge data sets, 30 million cancer patients that we, for example, have linked with hurricane events to look at the impact of climate change on cancer patients. So we have data linkage. We now have grant with NASA looking at satellite imagery for identifying the impact of wildfires on cancer patients. So it's these huge data sets that we do all sorts of statistical analysis. And yeah, most of the day is on the computer. And I think that that's so much fun. That's what I enjoy doing. It's almost like playing a video game. You know, advance through the research in a similar way.
That's incredible. I would love to keep going on and asking about what your Wednesday and Thursday looks like, but I won't do that to you. Camille, I'm curious. I'm going to throw the same question to you. What does a Tuesday look like for you?
Lately, it's been back-to-back Zoom meetings.
That's fair. That's fair. All right. So have you ever experienced particular challenges to being a woman in STEM? And if yes, what did you do to overcome them?
So is that still for me?
Yes, still you. Still in the hot seat.
Well, I mean, it gets better all the time. You know, when I started, there were a lot of women in biology as undergraduates, but as soon as you start, you know, going up to postdoc, okay, it still was kind of 50-50. As soon as you get into a tenure track position, boom, it goes way down. And I really, you know, I never felt discrimination until I came up for a full professor. There was that glass ceiling. And suddenly it was like, well, we really like you, but you're just not ready. And so I do think it gets better every year, or maybe every decade, maybe not every year, maybe every decade. And what Poppy went through is not what I went through. And I think the young people now have it even better. But I think it is still an issue. And to deal with it, really, I just sort of, I think there are really two things. Ignored the fact that I'm a woman and just plowed through. You know, it's just like, you know, I don't care how you treat me. I'm just gonna, you know, I'm gonna, as Poppy said, I've got my agenda, and doggone it, you're gonna hear it, and that's that. And the other thing was, you know, for the men who weren't behaving well, that I thought were trained, I shouldn't put it this way, this is being recorded, who were really genuinely okay people, I would take them aside for a beer at night and just kind of, you know, hey, this behavior, you seem like a really nice guy, but really, this is how this is being perceived, and you know, take my advice. You will get along better, and you'll get along better with all the other women if you sort of change it. And often the nice guys had no idea. Yeah, they just had no idea that they were being perceived in this way. So, you know, I do think that a lot of men really want to have a good, positive relationship and positive work environment, but there's no training for it. You know, as we're saying, there's no training for women. Fortunately, now there is some, but you know, if you think about it the other way around, then they just say, well, I just haven't a clue. I don't know how to treat women. It's like, forget we're women, but I can't do that. You know? So, anyway, I'm probably
No, I mean, I
Out
can't
there.
tell you how many people, even my own friends, have said that. Ignore the fact that I'm a woman, and even now when I hear it, like it gut wrenches me. It's an uppercut to the. I just hate it. I hate that. So we're gonna fix that. Okay, That's my goal. We're gonna fix this together. We're gonna fix this. Leticia, I'm gonna throw the same question back to you. So, have you ever experienced particular challenges for being a woman in STEM, and if so, how did you overcome them?
Yes, it's interesting. So I can give one example that it was like my boss's boss, and we were running these statistical analysis on some cancer clusters, which were really important for the community where the cancer cluster was a concern. And he didn't like the results. And then he told me, why don't you use your intuition instead of the statistical methods? Okay, so it is very hard because it's subtle, right? I think that it's not as blunt as it once was. And how do you reply to that and saying, I don't know, would you say that if I were a Russian man? Are you telling me to use my my intuition because I'm a Latinx woman? Like, what are you trying to get here? You know, it is very hard to address. And I know that there are institution structures in which you can report when something happens, but I have not seen those work really well. So I really do think that it has to be addressed almost before it happens, maybe more training for the male faculty before it happens with concrete examples, because they say they understand, but then they will make comments like this. So it is very hard. And I don't think that necessarily the burden of fixing it should be on the oppressed population, right? It shouldn't be on the women to fix this. We really need to switch the focus to the men in the room and say, you need to get trained. And if this is really important to you, if somebody told you that you had a terrible disease, right? You went to the doctor today and the doctor told you had a terrible disease, you're going to get home and you're going to Google it and you're going to figure it out, right? So if you really do care about more women in science, then you have to go look for the resources and the training to fix this. It is not on the women to fix it.
I agree. I completely agree on that. I love that you compared it to a disease. I'm going to have to use that in the future. But you're right. It's these microaggressions now. That's what our generation is dealing with. It's these subtle comments. And we have to decide, am I going to call it out? Am I going to say anything? And I love what Camille said about trying the one-on-one attempt where it's quiet over a beer, which is a little harder to do over Zoom right now. But I do like that approach of just kind of coming at it more of a friend place instead of being like, what the heck, man? Like, come on. Okay, so let's lighten this up a bit here. Toyin, I'm going to come to you. Let's go back to that quick question about what your Tuesday is like. Let's go light, real light here. What's a Tuesday for you?
Oh, me or Poppy?
For you. Let's go to you first, Toyin.
Oh, okay. What is a Tuesday like? Well, I think we haven't even talked about the sort of intersection of working and being a working mom. So I have a toddler. And I think Leticia just had her third baby. So I think anyone can comment as well on, balancing work and family. So I am often woken up very early by my toddler, Simone, who likes to kick me in the face. So I think that's how I'd start my Tuesday. But, I'm very lucky to sort of have this sort of dual career where my primary job is in technology, often doing meetings. And then I still I should say have the privilege of still seeing patients. And so I get to have a mixture. I would say my ideal workday is doing meetings and really thinking about innovative ways to improve healthcare access, but also getting the privilege to see patients and take care of them in our community. So I think that's really cool.
That sounds like the perfect day. And if that's your Tuesday, man, I want to hang out with you on Friday. I bet you're moving mountains. All right, back to these questions here. So how do you navigate a workplace atmosphere that tends to overlook historically excluded populations when giving out promotions? Toyin, we'll go to you, and then I'm going to throw to Poppy.
I think this, sort of plays on the question that we were talking about before about women. And I think most of the things that we've mentioned could easily be discussed for people of color as well. And I think often we think about people when really the problem is the policies, right? So there's a lot of sort of institutional structures by which are creating these ceilings that are very difficult for women or people of color to advance and be promoted regardless of their work. And so oftentimes in, corporate America, it is not a true meritocracy, right? Because there are so many ways in which explicit or implicit biases can affect the way that people are evaluated, and especially in scientific fields, who is publishing your work, who is collaborating with you, who's inviting you to conferences, who's inviting you to panels. Just being on this panel and looking at us four faces, this is like very different than the typical all white male panels that you see that are often include people who are getting promoted. So I think, I always think of like, you have to sort of like lift up as you reach up. So as you yourself get promoted, are you then making sure you're not replicating the same structural and inherent racism and misogyny in corporate America? Am I now trying to promote other women and people of color? Am I mentoring them? Am I collaborating with them? Am I inviting them on panels so that we can make sure that we are creating a sea shift so that other people can be promoted as we are too? So I think that's really important to think about.
I love what you just said there. Lift up as you reach up. I'm using that too in the future. That's amazing. Poppy, how about you? How do you not navigate through this? And how do you make sure everybody gets promoted that deserves to be promoted?
Well, I think I would be remiss if I didn't point out that today is Equal Pay Day, okay, in the United States. And we still have a massive problem with women being paid less than men, and women of color, even more discrimination there in terms of pay. So a lot of these structural inequities need to be dealt with in order for people to be promoted. When I went from being a computerist, I worked for a contractor at NASA, not for NASA itself, but I went from being a computerist to a member of the technical staff. One of the things that happened was that the promotion was delayed because the pay gap was so great to move me from where I was to the next level because of this huge pay gap that women experience. And there's legislation that's pending right now. The Fair Paycheck Act, for example, is in Congress, which would help in a lot of ways to remedy some of this pay discrimination, because we don't have pay transparency in many places. So you may be being discriminated against and you don't know it, okay? So you can't address it immediately. You have to understand that the pay that you're getting, your pay increases and your next job are probably dependent on the pay that you have from the past. So past discrimination is traveling with you everywhere. And then we have an additional problem about childcare that affects women tremendously, okay, in terms of, that you can't even count all the ways that that's going to affect women in terms of promotion, in terms of pay, in terms of opportunity. And right now, of course, because of the pandemic, we have 500,000 more women have gone out of the workforce over the last year than men. This is the worst year ever, the worst historical time ever for women in the workplace in terms of declining women. So we have just massive problems, and many of them need to be dealt with structurally by legislation, quite frankly. And that's part of why I encourage people, you need to be politically involved. And you also need to be politically involved just because you want to enter STEM, you want to enter one of these technical fields. Public policy is affecting what money is available in STEM. So if you're not at the table making your voice heard, you're going to suffer for it. Go ahead.
I was going to say, do you have advice for people for their first step? Our students are 18, 19 years old. What's the first step into being politically involved? How do you do that? Is it local? What's your advice there?
My first step would be, especially if you're sitting there in Austin, is to go down to the state legislature and watch them in action. First of all, it will increase your self-esteem immensely, okay? To see your elected officials in action. And, there's a lot of things that are happening right now. You can go and testify, okay? Unfortunately, they won't let you testify by Zoom unless you're somebody they invite. You have to actually go down there. But you can go testify. Go testify sometime. Pick an issue and go down there and testify. They're doing a lot of stuff that if you knew what they were doing, you would probably be horrified.
Well, all right. Challenge accepted.
To reiterate what Poppy said, and the fact that, I mean, I'm coming here from a healthcare lens, and I'm sure Leticia probably will want to comment on this potentially as well, but public policy affects everything that we're doing, and all policy is health policy: the air that we breathe, the water that we drink, our ability to have transportation, our ability to walk down the street and not be fearful of being shot, our ability to just live our life, is all affects our health. And so when we live in a country that is so rich and yet we have such low infant mortality, we have still Black mother mortality, and we still have lower life expectancy than other countries. You can start to look at the interplay of environment and society on your health. And so just even if you just want to get into STEM, but also if you just want to be a healthy individual living in America, like, most of the things that have improved health in our modern era have actually been public health infrastructure, whether it is clean water, whether it is smoking cessation, and those things require legislative change. And so it's really just important as well, and just reiterating what Poppy is saying, that just to be an active citizen requires some basic knowledge of public policy, and also the ability to feel confident to want to engage in that legislative process. And sorry if I threw Leticia in here, but I know this is your area. So.
Yeah, if we have time, I can comment, because the main focus of my research is disparities that can be addressed by policy. And really the way that I came to this is that, have you ever tried to help a friend lose weight? It's not easy, right? So if you look at individual behaviors, it's extremely hard. But when you look at the policies, you can impact so much more people. So sometimes the reasons why people smoke or don't eat a healthy diet or are exposed to some contaminants has nothing to do with their personal behaviors. It is because the only food that they have access to is a gas station, and there's no healthy supermarkets, and they have this allostatic load from the stressful situations daily that leads, and increased advertising in some neighborhoods that leads them to smoke more. So I think that really, as Toyin and Poppy were saying, policy touches everything, every single thing that we do. And it couldn't be more true that this is really the way to make a difference.
Camille, do you have anything to add to that?
Well, I mean, I'm thinking, people may be scared by thinking, well, I'm just not an activist type of person, and going and testifying is sort of scary. But I want to remind people that the first step is really, keeping up with the news. Know what's going on around you. And if there's an issue where you're reading an article in, say the New York Times, and you're thinking, oh, that can't be, that really, how can this senator be doing that? Write a letter to that senator. All right, you can email. It has an enormous impact. It really does. And I've heard this from senators and congressmen. It's like, yeah, what was it that I think there was a little ranking they had about an actual posted letter had the most impact, because that you have to go and buy a stamp, and you have to go to the post office, put it in a box, an email the next, and I can't remember what the third one was. It was some sort of more indirect thing, but it really does have a big impact because most people don't do it. So if you are too shy to sort of go up to the state capitol and testify, or to be in a protest march or whatever, just keep yourself informed, know what issues that you want to be involved in, and make sure that your representatives know how you feel. I mean, just write the email. Just it takes 5 minutes. Doesn't take long at all.
And then copy that text and send it to your best friend, and have them write the email as well, and send it out and make a huge chain.
Absolutely. And just getting people to vote. I was so happy. Of course, I was here during the last round of voting, but I was so pleased at how much people came out. It's like, oh, that's so fantastic. People are finally realizing their own personal power. It is, and I work with so many people from lower, less developed countries who cannot believe Americans who don't vote. I mean, they're just like, you've got to be kidding. We're working hard in my country to try to get the right to vote, to not have it be, just a sham. And you Americans don't vote? How could you do that? Americans just take it for granted, and it is not something most people in the world take for granted.
No, absolutely not. In my class, I offer extra credit because I want students voting and I don't even care. It's like a point on your exam, fine. If that's all it takes, whatever. That's 500 students, that counts. Okay, so we have still some more time. So let's go ahead and pop back to these questions. Poppy, I'm going to hit you up with again here. So what can BIPOC students, which are Black and Indigenous people of color and non-BIPOC allies, do to ensure we're seeing more voices at the table and an equitable distribution of power in STEM?
Well, I don't think it's just up to BIPOCs. I think it's up to all of us to try to be working on that. In terms of representation, it's important that those that are in these things go out and become ambassadors, in the sense of letting people know that you can do these things, that, you know, that there are opportunities that are available. It's amazing that there are still people who think, oh, I didn't know, you know, girls could do this. I didn't know so-and-so could do this. And so, you know, try to get involved. I think especially with people who are much younger than you, because these attitudes form very young with people. So try to go out to schools, you know, and talk to groups that are, you know, and even elementary students, to let them know about the opportunities and about how interesting these areas are. I would really try to encourage people to go as early as possible and try to deal with people.
Right, get to them young, build up their confidence. So if they do inevitably get the wrong answer in science class, it just brushes off their shoulder and they continue on, because they know that's what scientists do, right? We're always making mistakes and learning from them. Leticia, what about you? What do you think we can do to ensure that we're seeing more voices at the table and have an equitable distribution in the power in STEM?
Yeah, so I agree that starting with the younger generation is definitely a good way to go. And I think also try to think every time you're in a meeting or at a place where decisions are being made, how can you invite more people that are either being affected by these discussions or by these policies? And because a lot of times we talk about discrimination, structural racism, and it is a panel, right? A white man panel that is talking about it. And how can you truly have an understanding or even think about interventions when you have not one representative from that community in this discussion? So really call it out, try to invite, not only you personally invite more people of color to participate in these discussions, but call it out. Shouldn't we have somebody representative of that community in this panel or in this discussion or in this collaboration, this paper? Goes on.
I love that. There's nothing more ironic than showing up to a panel on women in STEM and seeing all men there. And you're like, did I misunderstand something? I think but it's happened. Okay, so Toyin, let's go a little bit more personable into your experience here. So can you talk a bit more about the projects and methods of Buoy Health, using some examples, please?
First off, I will say that the reason I work at Buoy, or about to start working at Buoy, I should say, is that I was a practicing physician for 5 years, building a clinic that I worked at. And I think that anybody who works in health on a day-to-day basis can see how sort of broken our healthcare system is. It's very complex and very hard to navigate. And there's so much inequity in how people access and comprehend care. And it's just obtuse, you know? And so as I was working in it, I realized how difficult it was for both patients who are just trying to navigate the system, as well as clinicians who themselves are burnt out, because we all kind of went into medicine in the hopes of helping people, and we are more likely focused on other ancillary concerns like billing and time that are, you know, put on us by healthcare systems. And so there's a lot of dissatisfaction on both sides of the coin. So there are a lot of exciting people, companies, nonprofits working in the space of making healthcare more accessible and easier to navigate. And one of the benefits of artificial intelligence is that it allows you to process data in a way that you can provide personalized recommendations for people. And so one of the things that Buoy does is that it's an AI based healthcare navigation tool. It's free, anyone can use it. And basically you can, and it's built on it's built on clinical data, right? And so you are actually interacting with an AI as if you were talking to a clinician, and it's allowing you to figure out, let's say when you're sick, what potential diagnoses those symptoms are due to, are caused by, excuse me, and then where to go. And because it's integrated into your insurance network, when it tells you where to go, it's actually a place you should go. Because oftentimes now when we're sick, we have to be the doctor, the insurance carrier, the Google Maps, an Uber, like we have to figure out everything for ourselves. And so that's just Buoy's goal, is to help people navigate the healthcare system to get the right care at the right time. And I do want to encourage all the students here that we often say, if you see something, say something, but also if you see something and you want to fix the problem, you should feel empowered to do that. That is one thing that you learn as a scientist. Have a hypothesis, test it out, prove it. And so if you feel like you see an issue, like I want to see healthcare be more accessible, go and figure out a company or a place that you can do it. I mean, I'm sure Poppy could probably say, like, he's a lawyer now, right? Like there's got to be, like a mid-career lawyer. Like there's always ways in which that you can, adjust and change your career, particularly if you're following something that you think is a true problem that needs to be fixed.
Oh, I love that, man. Okay, so that is so good to know. I'm going to be telling everybody I know about this process so they can actually access healthcare. I really think that is helpful for vaccines too. I don't know if that's something that can be helpful, but that's something we keep seeing here, is that our older generations are really struggling to navigate through the system and get their vaccines. So I don't know, is that something they can do through what you're talking about there?
COVID testing, and then with employers just rolling out now too, also vaccination strategies. And I think that's another thing where that requires that interdisciplinary approach, right? Like when you're talking about, COVID-19, right? That required technologists, public health, epidemiologists, public policy, legislative action, lawyers. And so I think the future is really multidisciplinary. And so we have to just be open to having multiple people who can help us solve these types of problems.
Definitely, 100%. Speaking of multiple people from different backgrounds, Camille here, what has your experience been on the Intergovernmental Panel on Climate Change?
Yeah, that's where I had to learn what all about economics over a beer late at night. Yeah, it's a very, very diverse group of people. Biologists are just one small part, and there's the climate scientists, but also the economist, the social scientist, the people, trying to health professionals, people trying to change social norms. How do we change society in order to make sustainability and lowering your greenhouse gas emissions? How do we make that actually work? And in under consideration of equity and justice, and it's big, and it's kind of overwhelming because there are so many aspects that you're trying to deal with. But it's exciting. What I love about being part of these big international panels is that you're really challenged all the time. So what I loved about being a student was the learning and the being challenged. And then you get your degree and you start actually doing the work, and that's of course that's still challenging. I'm not saying it's not, but after a while you're like, you get to where every single biologist working on this particular issue, and how they think, and and then you go into this different atmosphere where it's like you don't know anything. Suddenly you're like back to being a first year undergrad again. And I mean, we were trying to come up with a big statement, and this is going back a few years, in the third assessment report. So we're talking about the 1998. And the biologists, all three of us, were trying to come up with a big statement for the summary for policymakers. Climate change has already impacted many wild plants and animals, right? And the economists were just fighting us tooth and nail. You don't have the evidence for that. You can't say that. And honestly, the biologists were like, what are they talking about? We don't have the evidence. It's so bloody obvious. And so one of the economists, I actually got him for a beer. Yeah, I thought he's a nice guy and I'll get him out. And we spent the evening and I said, okay, I don't understand how you're thinking. And he starts talking and I'm like, I think you need to teach me economics 101 because you're thinking about this problem in such a different way that even though I'm trying to just tell you what the data are, we're not understanding each other. And he did. And I taught him ecology 101 and it was great. And it's just so exciting to be learning so much from the top people in the world. And then when you can come together, when you finally learn each other's languages, you can make something that really makes a difference. You come out with a report that actually makes sense to the policymakers because you've brought all these issues together into one framework. And it's very heady. It feels, it's a huge amount of work, but it really feels good. When you finally get that done, when you finally realize you're able to talk to the economist and they understand you and you understand them and you agree, and it's like, great, we could, it's like, when Obama had that "Yes, we can" as his chant, you start, yes, we can do this. So anyway, it is a wonderful feeling, and I really encourage people to stretch themselves, because stretching, yes, it takes energy. It's not always a nice feeling to feel stupid, because you're putting yourself in a situation that's not familiar, where you don't have training, right? And so of course you start out thinking, I don't know what's going on here, but just keep at it, keep picking it up, and wow, is that a really it's a rush.
Oh man, I can't even imagine what it is like being in that room. I would love to have been sitting there listening to the two of you teach each other like economy 101 and whatnot. I mean, incredible. So speaking of like stretching yourself and kind of pushing yourself to different places here, Poppy, do you consider the work you do now as a referral lawyer, president of Now, et cetera, queen of everything, as important or more important as your work at NASA?
I really do. I mean, one of the things I'm proudest of working on is working on passage of the Texas Equal Legal Rights Amendment in our state constitution. I mean, that guaranteed equality of rights for all Texas women in perpetuity. And I've worked long and hard for 50 years for passage of the federal Equal Rights Amendment. We're almost there. So yeah, all of those things are as satisfying to me as working in the space program. That was a fantastic experience, but there's many things to do in your life.
And what a great impact and legacy you're leaving for people like me and the younger generations as well. So thank you again. I know we keep saying thank you. We'll stop it. You probably get sick of that.
Well, you're my role.
Oh, go ahead.
You're my role model. You're my role models, you see.
Oh my God, I'm gonna cry. So you guys all heard that, right? Did someone record that? Okay, we're gonna write that. That's on social media. Okay, here we go. One last question before I open it up to all of you. But Leticia here, let's end with you. What kind of jobs, careers exist in cancer research other than oncology itself? And how can our students become involved in curing and minimizing cancer?
It's a really good question. So, well, there's a lot, and I can talk a little bit about it because I've done many different things. So when I was at UT, I was working with molecular biology and animal models on obesity and cancer. So when you're looking at more basic science, you can look at cancer etiology, prevention. You can use it, look at cancer therapy. Then you have the population side of it. So more looking at epidemiology and looking at studies that find out what kind of pollution is causing cancer in some places. And there's clinical trials that are going to test new drugs for new patients. And then you have the policy side. So you could spend 20 years investigating a molecule in an animal model. Then it passes every test. Then you spend 15 more years, with the clinical trials and the epidemiology studies, and you see that it was approved by the FDA, and then it was implemented in the population. And you see that the people who receive this new treatment really do better. 20 years after this treatment was invented, the cancer survival has truly improved. And then you look at this from a policy view, and you see that people who are uninsured never get this treatment. So I think that there is a continuum there, and there's so much that we can do in so many different levels with cancer research. It really goes way beyond oncologists. And as a cancer researcher, again, I've worked with scientists at NASA. I've worked, with economists a lot because of the price of cancer treatments. I've worked with physicists. I worked with molecular biologists. It is really an overlap, and I think that we all have been touched by cancer. We've all unfortunately have had a story of a loved one who we might have lost. And if this is something that you are interested in working on, there is no limit. You just see what it is that you have an affinity to, that you're most interested in, and most certainly you can make an impact.
Ooh, I love that. That is a good way to end. Okay, so we've got one last major question that goes to all of you. So I'm going to open it up and you all can just jump in here. But we want to end on a high note, right? Because we're encouraging our women in STEM. So what advice would you have for our girls right now who are still trying to figure out what specific field they are interested in pursuing, or perhaps what career or professional path to take? And I say girls, but I really mean anybody, LGBTQ community, anybody. Anybody want to jump in?
Well,
all right, I'm going to make Camille go first.
Okay. Well, yeah, I actually do have some advice, which is really to start going to conferences, because if you don't know what you want to do, the best way is like you find out what other people are doing and go to a broad one, something like, so the Texas Academy of Sciences has a conference that's, very broad because it's all sciences. American Association for the Advancement of Science once a year has a really huge conference. Actually, I think it has like 10,000 people that come to it. But again, it's very broad. So if you think you're interested in science, but you don't know what, go to one of these broad conferences, listen to talks. What excites you? We listen to a talk and you think, well, yeah, okay, but yeah. And then you go to another one, it's like, oh my gosh, that's what I want to do. Wow, how can I be this person? So it's just a really good way of very quickly, within a few days or a week, seeing a really huge array of what people out there are doing.
That's incredible advice. Toyin, you're next.
I would just say keep an open mind, because life is long, and most of us have taken circuitous paths to where we are. And so as long as you're open to following your curiosity and passions, and you feel that you are dedicated to serve your community, then you will be able to find something that gives you joy that you can do every day.
Oh, that is beautiful. Poppy, how about you?
Well, I still haven't figured out what I want to be whenever I grow up. Okay. So, so relax and enjoy it. Okay. Don't stress yourself out by feeling like you have to have this aha moment tomorrow. You may or may not have it. It's great if you do, but relax and enjoy it. Personally, the truth of the matter is, when I was an undergraduate at the University of Texas, I majored in beer drinking and campus politics. Okay. And that was actually very worthwhile. So, as I said, relax and enjoy it. Enjoy the whole experience of university life. Okay. Take your science seriously, but take other things seriously too. Have fun.
Well, that is absolutely an endorsement for the beer drinking and science thing. I like that. Leticia, we can't leave without your advice. What do you think?
I agree with all three of them, but especially with Toyin and Poppy. We can get so stressed out thinking that the decisions we're going to make as an undergrad is going to impact the rest of our career. Maybe, but you just don't know in what way, right? It could be the things that you do right now have a great impact that you cannot foresee. And it's not, there are no wrong choices, I think is what I'm trying to say. It's that pick your adventure. What do you want to do? And then go down that path. And it might change as you go to grad school or as you work at another professional capacity. So just pick your adventure and relax and enjoy your time doing it.
Incredible advice. I think in summary, what we heard was follow your passion and make the world a better place with it, right? And drink some beer on the way, maybe. Okay, so thank you guys so much. This concludes our Women in STEM panel discussion with Toyin Falola, Leticia Nogueira, Poppy Northcutt, and Camille Parmesan. I'd like to thank you all for joining us today and would like to thank our panelists for sharing their time, knowledge, and expertise. If you have any follow-up questions, please be sure to email cnsdev@austin.utexas.edu and hook 'em horns. Bye, everyone.
Bye.
Take care.